Hello and welcome to another episode of Clean Talk. We are on site at BAPIC here in Tampa, Florida. That's the Bay Area Association for Professionals in Infection Control, which is perfect for Clean Talk, the infection control podcast. And I'm very happy to have my next guest, Jay Filion, who's with Surfacide, is here with us today. Jay, welcome to the Clean Talk hot seat.
Yes, thank you so much for having me, Brad. Big fan of the show.
Well, full disclosure, I have known Jay since day one, and her father is actually my business partner at Seal Shield. So continuing in the family footsteps and infection prevention, and of course, Surfacide, we're familiar with your UV technology. What can you tell us about why you're here at BAPIC today?
Yes, thanks, Brad. Absolutely. So, like you said, infection prevention across the board in the hospitals, from everything from the keyboards to the operating rooms. That's our main goal. Every infection saved is a life saved. So I'm happy to be here working on that with all these hospitals in Florida. Looking forward to expanding that relationship throughout the territory.
And your business's main focus is around infection prevention. How did you get into that? What made you decide to pursue a career in this field?
Although Surfacide is not a COVID company, I am definitely a COVID employee. After seeing what was going on in 2020 and just the absolute mayhem, I wanted to get involved more in the medical space and then that infection space. And what a time to get in there and learn alongside with all of these doctors and everybody else in the space.
And we're here in Tampa. This is a home game for you, right? You're local.
It is, yes, located in St. Petersburg, but happy to work all over Florida for Surfacide.
And so you handle Florida, and what else is your territory?
Florida and the Caribbean, Puerto Rico, Dominican Republic, all of those. And Surfacide isn't just strictly in the hospital industry, we're also in the hotel.
And so you manage the hotel opportunities as well for Surfacide.
I do.
Fantastic. And are you seeing more traction? We are seeing much more traction of UV technologies within the healthcare space. Are you seeing it outside of the healthcare space?
We absolutely are. So, like I mentioned, I'm in that hotel space. That was huge after COVID, but it's kept a steady pace, especially with that. We're all talking about the perception of clean in hospitals, but that comes to the hotels too. They've also been making all kinds of steps since 2020 in a lot of big universities. We're also in a lot of touristy spots. We're here in Fenway with the Boston Red Sox. We're in the Seattle Space Needle, all kinds of great stuff.
Fantastic. And, we've spoken with Surfacide, and we're familiar with the products, but maybe you could tell our audience a little bit more about UV technology and why that's becoming more prevalent as a disinfection system in healthcare and other markets.
Yes, absolutely. The main differentiator between Surfacide and any other UVC company that you'll see is that we're the only patented multi-emitter system. So every other UV company out there, it's a single tower system that you're putting in a room. And think of it like a big flashlight. Some UV is better than no UV, but if that flashlight's spinning around, how is it hitting the other side of the bed maybe, or the anesthesia area or the bathroom? And that goes for all spaces, hotels, hospitals. And so that's the biggest difference between UVC vendors and Surfacide. And beyond that, the reason that we're seeing that UV works, we're getting into that data, is it's a wavelength. So there's UVA from the sun, UVB from like tanning beds, and then UVC, which reciprocated from our robots, is what's able to break down those harmful pathogens in the space.
Yeah, and in fact, the CDC has the data that shows the amount of energy and time required for each pathogen, because it's not all the same. But in general, UVC is effective against all pathogens. It's just determined on the dosage and the energy level. Talk a little bit about how Surfacide solution ensures the right dosage and distance for the best eradication of pathogens.
Yes. So having the triple emitters, being able to have those three different vantage points, basically triangulated around the hot spot of the room where those pathogens are really collecting, usually the bed. They're having the three not only makes them closer, so that dosage is higher, but then that delivery time can be shorter. So again, having the three in that much closer to all of the objects in the room make it so that there's less labor for the operator, and that these cycle times can be shorter, because we know that EVS and everybody else is already pressed for that turnover time, but you want to make sure that what you're doing is also effective. So Surfacide addresses that by having the multiple emitters.
And it also helps to overcome the issue of shadowing, right? Because rather than having one source, you have multiple sources to address the shadowing feature, right?
Right, because if it's in a shadowed area, that's not being disinfected. So beyond the 3 towers, they also spin 360. So we're going for that full room coverage to really eliminate the environment as a factor, because you know that if that patient before you came in the room, the New York Times posted that it's almost a 580% chance that you are that much more likely getting the same pathogen the person in front of you had. So
That's
trying to
unbelievable.
eliminate that environment.
So how does a practitioner determine where to place the 3 UV robots?
So first of all, with the 3 in the room, we know that the hospitals are pretty crowded for space anyways. So typically we like to say between 5 to 7 feet of that hot zone area. But what another thing that really differentiates Surfacide from some of the other UV companies is we're very hands-on. We're not a sell you your UV and leave. We have a program that we come back in 30, 60, 90 days. And then you're also getting assigned an account manager who can help with those trainings in those new spaces, because developing and implementing UVC at your facility isn't a 1 month project. It's definitely something you build, you hit goals, and you have to stick with in your hospital. Because if you want to see the data, it's going to be consistent.
And what are you seeing as best practice, or what is your recommendation for hospitals that want to implement this technology? Are they typically buying the Surfacide system for one floor, or do they buy multiple systems? What's typical?
Typically, it's a multiple system purchase, because you want to hit spaces like your ICUs, your ORs, and then your isolation cases are our top 3 areas. And with like a lot of other equipment that's in the ORs, you usually don't want it crossing that red line. So we say for about every 10 ORs, a system, and then kind of similarly with your discharge beds in the ICU and those isolation cases. I'd say typically a hospital from anywhere 200 to 300 beds usually starts off with about 4 to 5 systems.
Now, do you see utilization being more of stationary systems, or is this a mobile solution that's getting moved throughout the facility?
So I would say that my hospitals that have the most success in terms of actual data with reducing HAIs are the ones that are being so consistent, keeping them in the same areas. Because if you try to spread yourself too thin, then maybe that the burn unit got UVC 1 week, but next week it was, just the SICU or something like that. And while you're treating the space and it's making the differences in that space, that consistency of care isn't there. So it's harder to get that sort of data.
What do you call the Surfacide product that's the 3 robots? Does it have a name?
Yep, it's the Helios
The
system.
Helios. So aside from the Helios system, what other solutions does Surfacide have?
So beyond our Helios system too, you can break up those units. You don't have to just use all 3 at once. You can use 6 in a big auditorium, or 1 if it's in a public bathroom that you're having to use in a lobby or something like that. But then we also have, we're working with UV Angel for those type of spaces. This is where the UV is kind of going through a box, treating that air, and then being pressed out into those rooms.
Is that a new product for you?
It is, and it's a side product for us. We don't make the UV Angel, but UV as a product is better when it's bundled and you're hitting it from all these different angles.
And so that brings up, what is the best practice? Do you recommend terminal cleaning prior to UV disinfection? Is there other solutions in combination with the Helios that you recommend to maximize the effects?
Yeah, absolutely. It's UV is definitely an adjunct to the terminal clean. It's not going to replace it by any means. It's there to pick up anything that was missed. We're asking these people to clean the invisible. And so that's where UVC can come in and help. And beyond just treating those surfaces, it's super important to be treating those personal devices, whether it's, phones or badges and things like that. And then also making sure that that space isn't being contaminated even after the terminal clean before the next person comes in. So that's something like the UV Angel and stuff like that.
Well, you mentioned that you work in the Caribbean basin as well. What about the international market? Are you seeing the same type of proliferation of UVC solutions that we're beginning to see in healthcare here in the US?
Absolutely. I would say that if anything, they're pushing harder for it in the Caribbean and in Europe right now than
To what do
as
you
we've started to
attribute
go
that?
down. I would think that not because they've known that the data has been there just the same as we have, but they've really started to take in also that the marketing aspect of it, broadcasting throughout their hospital or throughout their hotel that, hey, we have this UVC and this data. And we actually did a huge study with Crothall. And although the study was to prove that C. diff, that daily UV cycles would decrease C diff in bathrooms, which we did prove. But we saw this incredible other story unfolded, and it was after that the operator was coming in there and asking a patient, hey, this is an extra step that the hospital has. We're going to put this robot in your room for 5 minutes for that added clean. And after that, we were seeing HCAP scores go up an average of 17% after 90 days, which is just an unheard of jump.
Well, and our infection preventionist audience knows that C. diff is hard to kill.
Yeah.
And the fact that you can use UVC after a terminal clean to help reduce C. diff rates and be effective against C. diff is also a huge, huge benefit. You mentioned that you're doing some sports facilities. I find that interesting. What is the application? Are these being used in the locker rooms or public spaces? What is typical?
So a little bit of both. The first one that comes to mind, because I'm a big Red Sox fan, it's Fenway. They're using that not only in the locker rooms for the athletes, but also the private box suite. So they'll go in there and treat that before, celebrities from across the country.
So
are
if
coming
we're
in
in the
to
cheap
do.
seats, we don't get the benefit.
No, you might see they do have them rolled out with the green monster usually when you're coming
Okay.
into the seats, but they don't. Yeah, they're not in between the aisles or anything yet.
Fantastic. And what do you see in the future for Surfacide?
I see a lot more of autonomy coming for Surfacide. We already spin 360 in the room and have a patented on our laser that measures the size of the room and the objects in the room so that the operator doesn't have to guess on that time for that 6 log
Talk a little bit
reduction.
about that, because we had talked about the placement. So you have a laser system that helps to determine best location. Can you explain that?
Yes. So all of our towers operate off of Bluetooth. You actually don't need Wi-Fi to run the system, which is huge in hospitals. And with that, they all talk to each other. There's a laser on top of all three. And what it'll do is it takes about 30 seconds and it spins around the room and measures all the objects in the room. And then it'll spin again and measure all of the distance of the room. So after it's calculated that, it'll spit out a time. It's usually somewhere between 10 and 15 minutes. And that's the appropriate time for that 6 log reduction. The reason that we went with the laser is so that there's not a guessing game with the operators, because even though most of the time they know what pathogen was in that room before they came, it's best to go for that 6 log reduction that kills C. diff rate. So that's what those lasers will do.
So with your experience with this solution in the healthcare markets and other vertical markets, what would be something that you would like to see happening in the marketplace? Is the challenge around, we see a lot of challenge around awareness, misinformation. What's it going to take for us to be able to have confidence in the systems we choose and the effectiveness of those systems?
It's absolutely the education and just awareness, because again, coming back to COVID, ever since then, UV has been a popular topic. So there's been a lot of new players in the game, but not everybody has necessarily done the homework on safety, on best practices and things like that. So my number one recommendation when you're looking at UVC is comparing apples to apples and getting data from not just the source that you're looking at, but also those third parties.
And again, it's not a silver bullet, but highly effective in conjunction with terminal cleaning and best practices for cleaning and care.
Absolutely.
Where do you see future opportunities for you? You mentioned markets outside of healthcare. Where do you see the growth coming in the future?
I think right now, UV in general is focused a lot on the short acute care term facilities, those hospitals. But I do think we're going to see it in a lot more of those walk-in clinics, of the Walgreens, those type of things, those pharmacy areas to be disinfected, because those are high pathogen areas too that people aren't quite paying as much of attention to because there's not as much traffic. But I think in the next couple of years, you're going to see UV in those spaces too.
So Jay, we're on site at BAPIC. How's the show been going for you so far?
It's been going great. Sunny in Florida per usual. Everybody's in a good mood. It's always.
But we're inside. It's sunny outside.
Yeah, but it's Florida, so everybody's on vacation. I've met a couple people today that are like very excited about the show, but they're much looking forward to their weekend at the beach.
Yeah, well, you can't blame them for that. So what are you hoping to accomplish here at BAPIC? What's the goal? What does success look like?
Yeah, my goal always, especially at the APIC conferences, is again that awareness and education, because I have the full confidence that once you're out there and you're doing your homework, that you'll be led back to Surfacide. So here I'm really offering out what we call dosimeters. And so that's actually a way
Tell,
that
tell
you
our audience what dosimeters are. Some people are familiar with this, but can you explain that?
Yeah, absolutely. So a dosimeter, and Surfacide doesn't make these. It's a third-party company, and a bunch of UVC vendors use these. So what a dosimeter is it's a little card that you can stick in the room. Usually you do 5 to 10, and you place them in different spots to validate that your dosage has been delivered. Because like we were talking about, with
And
that
it changes color if it's getting the right dosage of UV light, right?
Absolutely.
Not other things don't. It's just specific to UV.
Yeah, just UVC also.
UVC,
So,
okay.
the sunlight isn't going to change the color on it,
Got it.
things like that. Right. And so this is how you can compare not only, what spaces are being hit, but also, it was in there for 15 minutes. Did it truly deliver the dosage that's needed to kill those pathogens, or was it just a room that was glowing for 15 minutes?
Well, fantastic. Well, we appreciate you being on Clean Talk today, Jay. I'm your host, Brad Whitchurch. For my guest, Jay Filion. You've been watching Clean Talk, the infection prevention podcast. Until next time, remember to keep it clean.